Welcome to Ulosca channel. Access all nursing practice questions. Nursing Midpoint Assessment practice questions with answers.
Question 1. Which assessment finding is most concerning in a postoperative patient? A. Pain score of 5-10. B. Respiratory rate of 10 minutes. C. Oral temperature of 37.2 degrees Celsius. D. BP of 122/80 millimeters of mercury. Which one is the correct answer? The correct answer is B. Respiratory rate of 10 minutes. Explanation: a respiratory rate of 10 minutes is abnormally low and may indicate opioid-induced respiratory depression or other complications that need immediate attention. Question 2. What is the most reliable indicator of fluid volume status? A. Blood pressure. B. Skin turgor. C. Daily weight. D. Heart rate. Which one is the correct answer? The correct answer is C. Daily weight. Explanation: daily weight changes reflect actual body fluid shifts better than vitals or skin signs and are the gold standard in monitoring fluid balance. Question 3. Which technique is best for auscultating lung sounds? A. Over the clothing. B. Using the bell of the stethoscope. C. With the diaphragm on bare skin. D. Listening only anteriorly. Which one is the correct answer? The correct answer is C. With the diaphragm on bare skin. Explanation: lung sounds are best heard using the diaphragm on bare skin, as clothing can muffle sounds and anterior-only listening may miss posterior issues. Question 4. A nurse notes a new murmur during a cardiac assessment. What is the next step? A. Document and reassess in 24 hours. B. Notify the healthcare provider. C. Administer a diuretic. D. Encourage the patient to ambulate. Which one is the correct answer? The correct answer is B. Notify the healthcare provider. Explanation: new murmurs may suggest valve dysfunction or cardiac changes. Early notification helps prompt diagnosis and potential treatment. Question 5. Which of the following is a sign of early hypoxia? A. Cyanosis. B. Bradycardia. C. Restlessness. D. Decreased LOC. Which one is the correct answer? The correct answer is C. Restlessness. Explanation: restlessness is a subtle but early sign of hypoxia caused by the brain being sensitive to oxygen levels before other vital changes occur. Question 6. What is the proper order of physical assessment techniques for the abdomen? A. Inspection, palpation, percussion, auscultation. B. Palpation, percussion, auscultation, inspection. C. Inspection, auscultation, percussion, palpation. D. Percussion, inspection, auscultation, palpation. Which one is the correct answer? The correct answer is C. Inspection, auscultation, percussion, palpation. Explanation: auscultation must be done before palpation to avoid altering bowel sounds. Inspection always comes first in any system assessment. Question 7. A patient reports calf pain with dorsiflexion of the foot. What is this a sign of? A. Deep vein thrombosis. B. Cellulitis. C. Shin splints. D. Dehydration. Which one is the correct answer? The correct answer is A. Deep vein thrombosis. Explanation: Calf pain with dorsiflexion is often associated with DVT, a dangerous condition requiring urgent evaluation for clot presence. Question 8. Which lab value would most concern the nurse in a patient on warfarin? A. Potassium 4.0 milliequivalent L. B. INR 4.5. C. Hemoglobin 14 GDL. D. Platelet count 200,000. Which one is the correct answer? The correct answer is B. INR 4.5. Explanation. An INR of 4.5 is above the therapeutic range and increases bleeding risk, especially in patients taking warfarin. Question 9. The best time to assess for bowel sounds is A. Right after a meal. B. During ambulation. C. Before administering a laxative. D. Between meals when the patient is relaxed. Which one is the correct answer? The correct answer is D. Between meals when the patient is relaxed. Explanation. Bowel sounds are best assessed in a quiet, relaxed setting between meals to avoid peristalsis changes caused by recent food or movement. Question 10. Which position is best for assessing jugular vein distension? A. Supine. B. Sitting upright at 90 degrees. C. Semi-Fowler's at 30-45 degrees. D. Prone. Which one is the correct answer? The correct answer is C. Semi-Fowler's at 30-45 degrees. Explanation. JVD is best seen when the patient is in a semi-Fowler's position, allowing gravity to help visualize venous distension without exaggeration or compression.
Thank you for watching. For more practice exam questions, subscribe to our website at www.ulosca.com.